My name is David J. Simons. I'm an osteopathic physician, and I work at UPMC Lidditz. And I've been with the system for ever since UPMC purchased the hospital in 2017. Interesting story. When I was a child, I didn't know what I wanted to be, probably like most children. I liked athletics and I liked sports, and I thought maybe I'd be a coach. But I quickly became to realize that that probably wasn't in the cards for me. So even though I enjoyed sports growing up, I gravitated towards medicine, a field of medicine. My brother, who is 2 years older than me, was accepted to medical school. And my parents, interestingly enough, my mom was a librarian, and my father was a military guy who was in the Army and was in the Army Reserve for 25 years. And I think my parents wanted their children to be in the medical profession, possibly to take care of them as they became older. So my brother was accepted to medical school, and my parents informed me that they thought that I should go to dental school. And so my plan was to become a dentist until I nearly graduated college. And I said, wow, I don't think I want to be a dentist. My brother took me down to his medical school and gave me a tour. And I thought, wow, I could really see myself in medical school becoming a physician. And that's kind of how it started. I am really passionate about athletic activities, and growing up, I played a lot of basketball. When I went to medical school, I became passionate with the game of rugby. And then after I graduated from medical school, I came to Lancaster for my first job, and I realized that rugby was probably not a good long-term sport for my health. So I picked up the sport of cycling, and then a friend of mine introduced me to the sport of triathlon. I did my first triathlon when I was in my early 30s, and I became hooked on that. And so over the years, the past 5 years, I actually became a member of a triathlon club in Lancaster County, and athletes from all over the world are a part of this club. And I competed in the triathlon. I did my first Ironman actually last year, and in August of this past year, I competed in the world championships, and I came in third in the world in my age group. And a lot of people were like, "Wow, that's pretty cool." And I think that is cool because the world's a big place, and even as you get older, the competition gets even sometimes more aggressive because the weekend warriors tend not to end up at a world championship. But so I'm really excited and pleased and grateful for the fact that I can continue to compete, continue to do what I love to do, even into my mid 60s. So it's good stuff. Well, about 20 years ago, I took my bike across the country. We started in Everett, Washington, and rode our bikes across the country. We took the northern route. We ended up in Yorktown Beach, Virginia, and we did that in 24 days. Believe it or not, we averaged 140 miles a day. There was about 40 of us. It was a group, and that was exciting. It was interesting. It was challenging, and as you can imagine, it was exhausting. I had my three daughters were, as my wife says, my three daughters were in diapers, and I left her to fend for herself while I did this cross-country bicycle trip. But that was probably one of the most adventurous things I've done, and I still have good memories and develop relationships along the way that we've been able to maintain for many years. Yeah, so I have three daughters. They're in their 30s. My oldest daughter, her name is Samantha. She at age 4 months, she suffered a near SIDS event, and my wife found her in a crib, and she was clinging to life. We transported her immediately to the local community hospital, and she ended up at Hershey Medical Center in the pediatric intensive care unit. Unfortunately, she did not escape without serious damage of her frontal cortex, and she developed what they call anoxic encephalopathy. So she's been our challenge. we've, initially they said she would never be able to feed. They wanted to put a feeding tube in her. They said she'd never be able to walk. She'd never be able to talk. She's done amazingly well over the past. She's just turned 35, and she lives in a group home. She's as independent as you can possibly imagine. She walks and she volunteers here at the hospital. She goes to the pool just about every day. She has one-on-one supervision, and she's just as independent, as happy as you can imagine. She loves music, and she's just a real bright spot. But she's been our challenge child. I have two other daughters, and they're both very successful. My middle daughter just had her second grandbaby here at UPMC Lidditz, and she moved to Lancaster, so we get to be close to our little grandbabies. Are 1 and 3 years old, and my youngest daughter lives in Manhattan, and she's not married yet, but we're looking forward to possibly that happening within the next year or so. But it's been a great voyage. I think, some of the trials and tribulations that I've had to experience personally and professionally have made me more appreciative and more grateful for what we have right now and what we have today, what we enjoy. Well, yeah, I mean, it's interesting because the Amish patients are usually very cost conscious. So when they come to the hospital, they are not afraid to ask you what is this going to cost, and so most of them do not have insurance. They have a church, pools their resources to be able to pay for their care, but they're very they're very sophisticated regarding, what they do and what they don't want from a healthcare perspective. Of course, there's different levels of Amish, and some of them are much more sophisticated than others. But for the most part, they're very appreciative of what we do. They accept, adverse outcomes without, much pushback. I think they just have a sense of calmness about them, and it's really it's interesting to interact with them. They have a tremendous work ethic. As you can imagine, their days are long, and they have a lot of children. Mostly, we do a fair amount of obstetrics here in Lidditz, and we see patients that are gravid of 14, gravid of 15, having babies into their mid 40s, which oftentimes gives us some distress because the risk is obviously goes up as they become more advanced in years. And but generally it's a great community to be around, and we love seeing their buggies riding around the county. And on Sunday you see it's date night, and you see the young Amish couples, and it's just it's a refreshing sight, and especially this time of year. I would say the best piece of advice that I received was when I was a young intern finishing up my rotating internship just outside of Philadelphia. We were commenting in an elevator how quickly that year went by, and one of the senior physicians got on the elevator, and he overheard our conversation, and he explained to us that that year that we just experienced went by very quickly, but he said the rest of your life is going to go by almost as quickly as your last year. And so I think that that advice that I heard and what I took away from that conversation was that don't wait to do things you enjoy. Experience every day, and take all the different interactions you have and make the most of them. Maintain a positive attitude. Enjoy the differences of patients, and understand that some of them respond differently because of the stresses that they're experiencing. And don't take anything personally. We sometimes take things personally, and we turn a good day into a bad day because of some comment or something that went awry. So just understanding that this life that we have is going by very quickly, so you got to enjoy every single day and make the most of it.